Hello po and magandang hapon. Thanks for joining us on a Tuesday. And ganda po ng usapan natin. And we are going to talk po about mammogram and paano po natin may screen o paano po natin malaman kung meron po tayong breast cancer. So, the way that we screen is through mammogram, pero marami pong hindi nakakaalam what's a mammogram. So, today we are happy to have one of the most eminent radiologists and a friend for many years to join us. So, ako po si Dr. Ana York Bondoc. Our topic, our show is called Libreng Consulta. We are live on YouTube po and Facebook. And please put your questions below on mammogram, breast cancer, at pagtutulungan po nating sagutin po lahat yan. So tara, let's go! Our guest today is Dr. Joan Valdez. Dr. Joan is the head of breast imaging at the Asian Hospital and Medical Center. She is a breast radiologist. She's actually a radiologist specializing in CT, MRI, and breast. She graduated po from the University of the Philippines. She did her residency and fellowship there. She also did an observership abroad. And currently, head nga po siya ng breast imaging at Asian Hospital and Medical Center. So to answer all of our questions, kung paano ba mag-screen, kung masakit ba yung mammogram, sinong kailangan mag-mammogram, we are happy to join us today, Dr. Joan Valdez. Thanks, Joan, for joining us.
Hello, good afternoon. Thank you for inviting me.
Ayan.
Happy Breast Cancer Awareness Month.
Okay, tama yon. I forgot to mention. October pala is Breast Cancer Awareness Month. And so we are celebrating it by being aware and learning more about the issues. So, Dr. Joan, i-read ko na yung case, ha? Our case, Dear Dr. Joan and Dr. Ana, I am 40 years old at yung mami ko po ay na breast cancer about 10 years ago, but she is still okay. Ngayon po, I was advised to start to have a mammogram na rin po because of my family history. Kaya lang po, nakakabalita po ako na masakit po ang isang mammogram. So, ano po ba dapat malaman about a mammogram and paano ko po maaalis ang takot ko? Help me, Dr. Joan and Dr. Ana. Okay, Dr. Joan, if you were a radiologist at meron kang na-encounter na umiiyak sa labas ng mammogram, ako may nakita ng ganon, what would you do and how could you make her feel parang mas komportable sa sitwasyon?
Thank you for that case, no? So before we start, we have to know what mammogram is. So ang mammogram ay parang x-ray po ng breast, no? So we follow the recommendation of the American College of Radiology, which is for screening mammogram. Screening ibig pong sabihin wala po kayong nararamdaman. So ang screening mammography po, ang recommendation is magsa-start at age 40 and then yearly after that. However, we also have to ask for the family history ng patient, lalo na pag may first degree relative na nagka-breast cancer, so nanay or kapatid. So ang importante pong tanong ay kung ilang taon sila nung na-diagnose sila with breast cancer. So let's say yung sa case na yon na 40-year-old na female, yung nanay niya nagka-breast cancer. So kailangan po natin malaman kung ilang taon na-diagnose yung nanay niya. So kung ang nanay niya ay na-diagnose, let's say at age 45, we usually subtract 10 years from that. So she has to start earlier yung mammogram niya. So she will start at age 35. However, kung ang first degree relative ay na-diagnose at age 50 or after or older, then we still start at age 40. So if the patient is very anxious, tulad nung pasyente na umiiyak na, nandun nasa breast center, umiiyak tapos natatakot, we would rather not push through with the mammogram kasi very anxious yung pasyente, no? So we would like yung environment is relaxed at hindi, as much as possible, hindi stressful sa pasyente. So if there are patients na takot magpa-mammogram, we usually advise it. Ang important doon is the timing of the mammogram. So The best or ideal time for a mammogram is during the 7th to 10th day of the cycle. Ang bilang po nun, first day of the cycle is the first day of the period. So let's say, dinatnan ka ng October 1. So October 1 is day 1. So your ideal time for a mammogram, ideal because it's the least painful, para i-mammogram kasi iipitin po yung breast, no? So your 7th to 10th day is October 7 to 10. So that is your 7th to 10th day. And if medyo mababa po yung pain threshold nyo, you can also take mga pain relievers the day before, on the day of, and the day after. Somehow it will help, parang help you tolerate the procedure. So that is always been a challenge for us to encourage patients na magpamammogram kasi maraming nagsasabi masakit magpamammogram. Pero ang palagi ko pong sinasabi, depende po yan sa pasyente kasi iba-iba ang pain tolerance ng ng each patient, no? Yung iba mababa talaga, hindi pa iniipit, umaaray na. Yung iba ipit na wala pang nararamdaman. So it's very variable, iba-iba po. If mataas po ang pain threshold niyo, malamang kayang-kaya niyo po yan. And yung ipit po ng breast sa mammogram, sandali lang po yon at dahan-dahan po iniipit. Hindi po biglaan na iipitin yung breast nyo, no? So dahan-dahan hanggang sa kaya nyo. And then, after po makuna na ng image, marirelease na po kaagad yun. Hindi po yun nakaipit na permanente.
Okay. So, wag dapat nervyusin. Thanks, Dr. Joan. Okay. Bakit nga ba, okay, explain the procedure. Ba't siya iniipit? What's the point?
Okay.
Bakit sa lalaki walang iniipit? Okay, parang may nagsabing ganon.
Iniipit, the purpose of yung pag-ipit, no, yung compression, is to spread out the... Because before, nung wala pang digital mammogram, nung analog pa, kailangan talaga ipit na ipit. But now with the onset of the digital technology and the new technology na 3D tomosynthesis, we could somehow manipulate the images. Parang kung dati yung camera, di ba, point and shoot. Tapos magdasal ka na lang na maganda yung picture mo. Ngayon, pag digital camera, somehow pag in-upload mo, let's say sa computer mo or sa laptop mo, you can, let's say, pwede mong timplahin yung brightness or yung clarity. So that's the equivalent of the digital mammography ngayon. So even though hindi na natin iipitin ng ganun ka grabe, kailangan pa rin ng compression to spread out the breast tissue.
Okay. So yun pala, it's part of the procedure talaga na kailangan talagang gawin at hindi tayo makakaligtas doon. Okay. Question, what is the difference between screening at menaka pa?
Okay, when you say screening, yun yung asymptomatic. Ibig sabihin walang complaint yung pasyente, nagpapa-check up lang. So, screening is usually yearly, unless may makita, and then we have to monitor more closely. When you say may nararamdaman na yung pasyente, so that's a diagnostic mammography. Basically, it's just a terminology, but you still do the same thing, no? Yung mammogram. So you take 4 images of the breast, no? 2, dalawa sa kanan, dalawa sa kaliwa, in different orientation. So with those 2 images, we can see if there are, let's say, may buccal or may calcifications or anything abnormal sa breast.
Ayun. Okay. Question, Dr. Joan. I've always wanted to know this kasi I always have people coming to me na naiiyak daw dahil may breast cancer na sila based on a mammogram alone. Tapos, ano ba tong BI-RADS na to? At parang, I can't stop people. Sabi ko, how do you know you have cancer just based on a mammogram? Hindi pwede yun. Tapos nag-iiyak na. Can you explain to us what is the BI-RADS and napaka-accurate ba nito or what?
The BI-RADS is an acronym, so it stands for Breast Imaging Reporting and Data System. So it is parang it was developed by the American College of Radiology to standardize lahat na readings. So let's say, dito ka nagpa-mammogram, kung dadalhin mo yun sa US at may BI-RADS, basically magkakaintindihan yung mga doctors. So it's a standardized reading or interpretation ng mammogram, pati ultrasound. Bina-BI-RADS din yun. Okay, so there are 7 categories. So nakalagay yun usually sa report. When you say BI-RADS 1, ibig sabihin normal yon. When you say BI-RADS 2, may finding pero benign. When you say BI-RADS 3, may finding na most likely benign pero kailangan i-follow up. Usually 6 interval. Okay? So BI-RADS 4 and 5 are usually diagnosis na may suspicious for cancer. So usually if we sign out a report, BI-RADS 4 and 5, i-refer kayo to a surgeon or an interventional radiologist to do a biopsy. So that means na suspicious for cancer. So it can only be definitive cancer once you get a sample.
Okay. So, hindi dapat mag-hysterical. Hysterical people holding, BI-RADS, ano po ako? I was like, wala ka pang biopsy, hindi pa natin alam yon. So, relax lang and just proceed towards the biopsy. Tama ba ako? Oo. Ang dami nagwawala sa clinic ko over this BI-RADS na to. Ngayon ko lang naintindihan bakit nga ba. Kasi ako, I always rely on the biopsy report, not on a radiology report. So, dapat kalma lang and just keep on going through the process. Yeah. Okay. Question, when, di ba, it's controversial when to start screening? Parang may issues na ganon.
Yes.
Oo. Can you explain to us the age? Sino ba si high risk? And bakit dati may narinig ako 50, then naging 40. Tapos ngayon may narinig akong 35. So paano ba?
Different bodies have different recommendations. And every pag Breast Cancer Awareness Month, nagdidebate sila about that. But we follow the American College of Radiology, which is ang screening mammography recommendation is at age 40. And then yearly onwards, now the question is when to stop. Kasi we also have patients in their 60s, 70s, even 80s who are diagnosed with breast cancer. So when do you stop? The recommendation is if you don't expect to live within the next 10 years, then you stop.
Asama naman nun.
No, because you get diagnosed, what if you have medical issues, medical conditions that getting a surgery.
Hindi ka naman makakakimo, ganon. Oo.
And then, or you have other medical conditions that are more pressing at the moment. Like let's say nagka-cardiac failure ka na, nagre-renal failure ka na, siguro mas urgent naman
Huwag mo nang problemahin yung mammogram mo muna. Yeah. Pa-dialysis ka muna. Okay, yes. Okay, I got that. So, start at 40. Ano yung 35 na naririnig ko ngayon na high risk daw?
Well, yung mga high risk nga are those that have first degree relatives that were diagnosed younger than 50. Then you start earlier than 40. Yun na nga. From the age of diagnosis of the first degree relative, you subtract 10. Then that's when you start.
Ayan. Okay. Bakit? Ako, share ko, I have dense breasts. Tapos yung mommy ko was diagnosed at age 50. Pero at the age of 33, sinabihan ako na parang I had lumpy breasts daw. So, I needed to get daw checked every year. At hindi lang mammogram, but ultrasound. What's the role of the ultrasound naman sa screening?
Okay.
Bakit ako dalawa yung kailangan kong gawin? Yung iba, isa lang. Oo.
Actually, screening for breast cancer is mammogram. Because the early cancers, where there are no masses pa, they are seen in the mammogram. But as with all other examinations, may limitation ang mammogram. So ang limitation niya is if the patient's breast is dense. Ang ibig sabihin nun, yung breast tissue parang siksik. So ang makikita namin sa mammogram, puti lang siya. So kung may bukol, especially if maliliit, hindi namin nakikita sa mammogram yun. So that's the role of the ultrasound. So that's where ultrasound comes in. So actually, mammogram and ultrasound are complementary. Kung ano yung shortcoming ng mammogram, yun yung nakikita sa ultrasound. Kung ano naman yung hindi nakikita sa ultrasound, yun yung nakikita sa mammogram.
Dr. Joan, please tell us more. Ano ang hindi nakikita sa mammogram na nakikita sa ultrasound and vice versa?
Yun, when your breast tissue is dense, yung mga maliliit na bukol na nakikita sa ultrasound can usually not be seen sa mammogram. So yun ang role ng ultrasound. But the early cancers, yung wala pang bukol, hindi nakikita sa ultrasound yun. So you can have a normal ultrasound, pero may finding ka sa mammogram. So ideally, if finances are not a problem, you do both.
Dapat dalawa. Okay.
Especially if
Totoo.
your mom signed out.
Sige. Okay. As you get older ba, what is the meaning of dense sa breast? Anong dense yun?
Dense is, let's say, parang forest. Okay, imagine a forest. So when you have a dense forest,
Okay.
trees. So kung may nagtatago na hayop doon, hindi mo siya makikita. As compared to a forest na iilan lang ang puno. Pag may hayop doon, kita mo na kaagad. Okay, so when your breast is dense, pag may bukol, mahirap makita. And as a rule, the younger you are, the denser the breast. So the older you get, nagiging fatty yung breast. So kung may bukol, mas madaling makita if your breast is fatty.
Okay. Ngayon ko na So, but ultrasound alone is not acceptable. Dapat ultrasound and mammogram.
Yes, ultrasound is not the modality for screening for breast cancer. It's really mammogram.
Okay. And then additional na lang si ultrasound condense yung breasts mo.
Yeah.
Okay. A further question, what is an abnormal finding on a mammogram and what are calcifications at bakit sila nagka-calcify? At ano yung nagka-calcify? Hindi ko alam. Oo.
Well, calcifications
at bakit sila micro-calcification? Yan.
Okay. Calcifications are deposits of calcium. Para silang bato, pero maliliit. So you have the microcalcifications, which are very, very small, mga less than 1 millimeter. So, and then you have the macrocalcifications. Ang mas nakakatakot are the microcalcifications. Yung mga malalaking calcifications, they are usually benign. So if we see microcalcifications, not all microcalcifications are cancerous or abnormal. There are microcalcifications na benign. But there are certain microcalcifications na nakikita namin sa mammogram which are early stages of cancer. So yun yung mga wala pang bukol sa ultrasound.
Okay, so now I know. So if you have microcalcifications, dapat imbestigahin yon basically.
Yes, sometimes when we see calcifications, we ask the patient if we could get additional views. Parang minamagnify pa namin para ma-characterize namin better yung microcalcifications.
Okay. All right. And what are the benign findings? Kasi nabanggit niyo yung microcalcifications are possible malignant findings. Ano naman yung hindi cancer? Like, what would a cyst look like? Ganoon.
It's difficult to say whether a mass is a cyst or a solid mass sa mammogram. So that's the role. Ang role
okay.
Characterize kung ano yung mass.
Kung solid or hindi.
Solid or cystic, yes. And dun din nakikita better margins and may iba pang mga features na nakikita sa ultrasound.
Okay. For those who don't know, masakit ba yung ultrasound or hindi, Doktora Joan?
In general, hindi. But there are some areas that we have to investigate, like kung may area na gusto namin makita na medyo malalim, medyo nadidiinan ng konti. But in general, hindi.
Hindi naman. Okay. All right. And one question, bakit kailangan naka-timing sa menstrual cycle yung yung mammogram? What are you trying to avoid?
Oh, that is yung 7 to 10th day is the ideal time. Yun yung kung pwede mo lang i-timing. Because that is the least painful. But you can actually have your mammogram anytime. Pero let's say
least painful. Okay.
Yes. Yung mga perimenopausal na nagsiskip na ng period, mahirap naman i-timing yun. So you can have it anytime.
Kahit time.
Yes. Pati yung mga postmenopausal, they can.
Yan. Doktora, parang meron nang nagtatanong sa atin. Let's wait for Miss Kat to project our questions, Joan. Yan. Para, ayan. Pakibasa lang, Ma'am Kat.
Okay po. From one of our viewer po, bakit po kailangan pisain?
Malabo na yung mata ko pa. Bakit po kailangan
pisain?
Sorry, hindi ko mabasa, Kat. Go.
Okay, the question is bakit po kailangan pisain ang breast sa mammogram? As I said earlier,
ayan. Sige, one more time na lang sa mga ayaw talagang pisain ang kanilang breast.
Kailangan ipitin.
Pwede bang konti lang daw yung pisa? O, yun.
Kailangan ipitin yung breast para mas spread out yung breast tissue. So, if hindi kasi ipitin, hindi like yung mga calcifications, hindi yan namin makikita pag hindi naiipit ng maayos. Pati yung mga bukol, sometimes, especially yung mga nasa likod na ng breast, yung malapit na sa chest wall, hindi rin namin nakikita yon. So, ang compression is para mas makita namin ng klaro yung breast.
Hello po, naririnig niyo po ako?
Yes.
Yes po. Okay, next
Ako daw na lang,
question.
John. I cannot...
Yes. The earliest age for mammogram. So the recommendation is screening mammography yearly at age 40. Unless you have a first-degree relative, so nanay or kapatid, na nagka-breast cancer younger than 50. Then, isubtract nyo po ng 10 yung edad. So kung ang nanay nyo o kapatid nyo na diagnose ng breast cancer, let's say at age 48, ang umpisa ng mammogram nyo ay 38.
38. Okay. All right. Okay.
Dr. Joan, narinig niyo po ako. Please do a thumbs up po. Please.
Ayan, ito, what is the oldest? Parang what's the oldest na mammogram nyo na, Joan?
Our oldest is 85. We have patients who are in their 80s na papamammogram pa.
Next question po. Ako na po magbasa. Okay po.
Yes.
Paano po pag may breast implants?
Okay. Hindi po bawal magpamammogram kahit may breast implants. Ang ginagawa sa mammogram pag may
Ayan,
breast
magandang tanong yan. Oo.
aside from the standard na 4 views, mayroon pa kaming kinukuha na additional 4 views. Inuusog po namin yung implant palikod. So may 4 na views na may implants and then may 4 na views na walang implants. Hindi po bawal magpamammogram kung may implant.
Okay. Next question po. Nabasa ko po ang males may breast cancer din po. How should they be screened? Mammogram po ba?
Yes, males can also get breast cancer. Usually, yung mga patients na lalaki na nakukuha namin, ang presentation nila or ang complaint nila is usually may nakakapa. So ang una usually na ginagawa sa kanila ay ultrasound.
Oh, I see po. Okay, next question po tayo. Pagkatapos ma-treat ng breast cancer like mastectomy, kailangan pa ba ng mammogram? Sa kabilang breast po ba?
Yes. Even after mastectomy, kung tinanggal na yung isang breast nyo, kailangan pa rin i-mammogram yung kabila. Having a breast cancer sa isang side is your incidence of getting breast cancer sa kabilang breast nyo. So tuloy pa rin ang mammogram.
And
Okay.
next question po.
Question from another viewer po, Doc. Kailan po sa menstruation cycle magpapamammogram? Is this important?
As you mentioned earlier, my ideal time because it is the least painful for the patient. So yung least painful is the 7th to 10th day of the cycle, the first day being the first day of your period. But it's just a recommendation, and you can have your mammogram any day of your cycle.
Oh. How about breastfeeding moms po?
Usually, sa mga breastfeeding moms, we don't recommend mammogram because during breastfeeding, nag-iiba yung architecture ng breast. Nagiging mas dense pa siya on mammogram. So we usually don't recommend it. If the patient wants to get a mammogram, we recommend getting it 6 months after tumigil siya mag-breastfeed.
Okay po. Bakit po yung iba, ultrasound pa yung kailangan? What's the difference between ultrasound and mammogram?
Okay. Screening is mammogram. Screening, ibig sabihin wala kayong nararamdaman. But if your mammogram is read out as meron kayong dense na breast, most likely you will be recommended to have an ultrasound. Pag dense kasi ang breast nyo, pag may bukol, medyo mahirap po yan makita sa mammogram. So ang role ng ultrasound is to see if may maliliit kayong bukol, and kung mayroon, to characterize it. Characterize, ibig sabihin kung titingnan kung solid siya, solid mass, or cystic mass, or yung iba pang features ng mga bukol.
From Miss Josefina Aguilar, at the age of 65, pwede pa po bang magpa-mammogram?
Pwede po, ma'am.
Okay po. From Miss Cherry Santos po, magkano po ang magpa-mammogram, Doc?
Ako, iba-iba po yan. Iba-iba sa iba-ibang hospital.
Oh, ganun po pala yon. Okay po, from Miss Cindy Abines Cantillo. Good PM po. Paano po kung maliit po ang breast or flat-chested? Mahirap po bang i-mammogram?
Kahit po flat-chested, kaya pong i-mammogram. Ang lalaki po, kaya rin po i-mammogram. So, ang medyo difficulty lang po doon, mas mahirap at mas matagal lang, mas masakit po para sa pasyente kasi hihilahin po yung buong breast.
So, mas masakit siya, okay, kung flat-chested. Baka naman kaya galit yung mga Pilipino versus yung mga abroad. Hindi ko alam. Okay. So, totoo ba to? Mas masakit kung wala kang masyadong boobs na mapamammogram? Is that your experience? I don't know.
Based on the feedback from the patients, mas nasasaktan it. Kasi we have to pull out the breast eh.
Nakakanervous naman yun, Joan. So, kailangan talagang
Yes. As I said, yung compression, dahan-dahan siyang iniipit, hindi yung bigla na lang nabagsak na iipitin. So, dahan-dahan yun iniipit. And then once na nakuna na ng image, release na kaagad. So, the compression mismo is around maybe 2 seconds lang.
2 seconds. Okay. Ako muna, Ma'am, Miss Kat. Question lang, Joanne. Hindi ba pwedeng, marami rin nagtatanong sa akin, Doktora, hindi ba pwedeng breast self-exam na lang kasi nininervyos? So tell us, Joanne.
Breast exam is important also, no? Kasi yung pasyente mismo ang may pinaka-access sa sarili niyang breast. And the more you do the self-breast exam, the more familiar you are with your breast. Pero hindi kasi lahat na bukol nakakapa.
Ayun. Yes, very good answer. It can miss a lot pa. Oo.
By the
Baka merong hindi makapa. Okay.
yes,
And what is the accuracy of a mammogram, lalo na pag early?
What do you mean?
Like, halimbawa, let's say, normal yung mammogram. Are you fairly sure na normal? Mas marami bang false positive o mas marami bang false negative? Ganon. Like, kasi marami akong narinig na sinabing meron silang bukol tapos wala naman. At least BI-RADS nga. Oo.
Okay. The sensitivity of mammogram decreases.
Yeah, sensitivity. Yan, yes. That's a term. Oo.
Sensitivity of mammogram decreases pag dense ang breast. That's why you need ultrasound. So ideally, you do both.
Okay. Pero more or less like 95% okay naman pag normal yung mammogram mo. You can go home naman na medyo kalmante na. Oo.
Yes.
Oo naman.
Yes. But better pa rin to do if your breast is dense.
To do. What is the role of the MRI, Joanne?
MRI, we usually recommend MRI.
Kasi ako na MRI na twice pa. So, what's the role of this?
MRI actually is mataas ang sensitivity, pero mataas din ang false positive. Okay. We usually recommend MRI for patients with implants. With mammogram and ultrasound kasi, sometimes we cannot see yung likod ng implant. So, since MRI is a 3D study, so mas nakikita yung buong implant. And especially for mga intracapsular rupture ng implants, MRI is the best modality to evaluate that.
Okay. Kumusta naman yung mga pregnant na may nakapa? Paano yun? Siyempre, masama x-ray sa kanila.
Yeah. If you're pregnant, hindi pwede magpa-mammogram. Because mammogram may radiation yon. So, if you're pregnant and then may nakakapa, ultrasound.
Okay. Parang Miss Kat, may mga tanong pa ata. Ayan. Ayan, from Ma'am Vilma. Mabilis na lang, parang nasagot ni Dr. Batista.
Okay, from Miss Vilma de la Cruz, which is more accurate, mammo or ultrasound?
It depends on the breast. Yun na nga. May, bawat study may limitation. So yung mammogram, if your breast tissue is dense, pwedeng hindi makita yung mga bukol. Sa ultrasound naman, you can have a normal ultrasound, pero yung mga calcifications na suspicious na nakikita namin sa mammogram, hindi po yun nakikita sa ultrasound. So, mammogram is complementary.
Yan.
Ayan po. Doktora, saan po ang clinic nyo? Gusto ko po sana sa inyo magpa-check up. Madalas po kasi sumasakit ang breast ko po.
I work in Asian Hospital. We have a breast center there. So when you go to the breast center, you get a consult with the breast surgeon. And then the breast surgeon will give you a request kung kailangan mo ng mammogram, ultrasound, or kung ano pang ibang test. So they can examine you.
Ayan. So for those looking for Dr. Joan, she's at Asian Hospital and Medical Center. At pwede po kayo mag-request ng ultrasound at siya mismo yung gagawa. Okay? Yan. Kasi talagang personal care ang kanyang ginagawa. So John, thanks for updating us. Do you want to go through the pictures mabilis lang para people can just have some idea kung ano yung itsura ng mammogram machine? Yes. And then I think Doctora also sent us some pictures, no? Nung kanyang parang yan ata. Sige, Doktora, please explain. What's that?
Okay, so that's a new technology right now for mammogram. So it's a 3D tomosynthesis. So unlike yung dating digital mammogram, yung bago na ngayon, yung 3D tomosynthesis, para na siyang CT scan. So instead of just one image na nakukuha, multiple images po, parang slices na po throughout the entire breast ang nakukuha niya. So kaya po namin...
hindi ko alam yun, that's new. Oo.
Yeah, so for almost the same amount of radiation, we get more information with the new technology. So you
can see so much more.
Most patients say na iniipit yung breast ko ng bakal. No, hindi po yan bakal, plastic lang po yan. So yan po, iniipit po yan.
Plastic lang po yung iipit sa inyo. Ayan.
Unti-unting iniipit, tapos pag nakuna na ng image, release na po kaagad. So that's around mga 2 seconds lang, 2 to 3 most. Sandaling-sandali lang. Kayang-kayang tiisin. Okay, so that's a photo of a patient na minamammogram. Nakangiti pa siya, oh. So ang mammogram, kinukunan po yan na nakatayo. Okay, so that is an image of a mammogram na normal. Medyo dense po. Nakita niyo po breast tissue. Yung breast tissue yung mapuputi sa gitna. So kung may maliliit na bukol, hindi na makikita dyan. Sa ultrasound natin makikita. So we get 4 images po. 2 sa kanan, 2 sa kaliwa. So, ito po ay mammogram na abnormal. Yung nasa kanan na screen, yan po yung may bukol. Yung medyo bilog sa bandang kanan. Ito naman po yung other view. So, nandun pa rin sa kanan yung maputing bilog. Bukol po yan.
Okay. Thanks for clearing up so many questions para sa akin, Joan. I learned a lot, lalo na yung viruds na yan. Oo. And thanks so much. Question, kung na-mastectomy ka, hindi ka na may mammogram dito, diba? Sa kabila na lang.
Sometimes we do, yung kilikili nung side na mastectomy. Pero most patients complain na masakit yun. So, we can forgo that. Ang ginagawa na lang ultrasound.
Okay. And, okay. So, I think that's all the questions that we have. Thanks so much, Joan. Can you give us words of hope sa mga natatakot? Yan. What should they, para lumakas ang loob nila?
To my fellow women out there, huwag kayong matakot magpamammogram. The technology now is so much better. Hindi na kasing ipit na ipit as before. And if you're apprehensive, we can talk you through it. We will guide you through it every step of the way. Ang isipin niyo po, ang mammogram ay nakakatulong sa atin. We diagnose a lot of cases na walang nararamdaman yung pasyente. Yearly nagpapatingin, tapos may nakikita kami sa mammogram nila. So they're very thankful na ginawa nila yon every year. At nahuli namin na wala pa silang nararamdaman. So they were diagnosed early. And the earlier you are diagnosed, the better yung prognosis, mas maganda yung survival rate. Breast cancer is very treatable now as long as you have yourselves checked. It's October, it's Breast Cancer Awareness Month. Meron pang ilang araw, pwede kayong magpamammogram pa.
Yes, super thanks, Dr. Joan, my very good friend, my sis, an excellent radiologist, a mom. Thanks for joining us. And sa mga age 40 and above, pamammogram na kayo. Okay? Go to Asian Hospital today or tomorrow. Schedule na kayo. Thanks so much, Joan.
Thank you, Anna.
Yay! So that's it. We talked about breast cancer surgery. We talked about breast cancer screening. On Thursday po, we're going to talk about survivors naman. We're going to talk to survivors of breast cancer. We have Mrs. Emily Aliwalas Bais. She's my cousin and my tita, Mrs. Purit Aliwalas. And we're going to do personal sharing po on breast cancer. So si Emily po is a survivor. I'm a daughter and si Tita Purit po is the mom of a breast cancer patient. So on Thursday, we'll do stories on breast cancer, stories of hope, yan talaga, on how to move forward from a diagnosis and how to find po what to do, how to do it with confidence, with joy, and with the support po of your family. So sa inyo po lahat, thank you, Dr. Joan Valdez, very good friend. Pamammogram na po kayo. October is Breast Cancer Awareness Month. Maraming salamat po.